but we know we have to have a long road ahead of us before we can get back to our way of life. That's why today we're also announcing that we will once again be establishing another public health emergency and maintaining the statewide mask requirement for another 60 days as we continue to work on distributing vaccines across the state. Because while there's light and hope at the end of this tunnel, this virus hasn't gone away. In just a 4-day period from Monday through Thursday this week, 9,092 Wisconsinites tested positive for COVID-19. 426 were hospitalized and 133 Wisconsinites unfortunately passed away. So folks, don't give up now. Wear your masks, stay home whenever you can, support businesses, and catch up with families virtually. And let's get together. Let's get through this pandemic together. If not for ourselves, for the 5,290 Wisconsinites who are no longer with us. Thank you so much. And now I'll turn things over to Prevea CEO, Dr. Ashok Rai. Dr. Rai.
Thank you, Governor Evers, for the state of Wisconsin's unwavering support and partnership throughout this pandemic. Prevea Health continues to be extremely honored to partner with local public health departments and the state of Wisconsin throughout this pandemic, from COVID-19 testing efforts to the more recent undertaking of our COVID-19 vaccination efforts. We could not be where we are at today without these partnerships. They are vital as we have gone through the process of vaccinating our own healthcare workers and then vaccinating unaffiliated 1A healthcare workers. When it came to planning and executing our own vaccine launch, my motto and guiding principle was to aim small, miss small. When launching our internal vaccination clinic, we started small on the first day to make sure we learned from our own experiences in order to begin scaling up. And we did just that. We learned and we quickly vaccinated our own, as well as our hospital partners' employees. Then we met the goal of vaccinating our unaffiliated 1As and have since delivered almost 9,000 doses of vaccine since December 16th, 2020. We will take this commitment to the next level as we unveil Prevea's first mass immunization clinic on the campus of the University of Wisconsin-Green Bay next week. This is the largest vaccination effort of our lifetime. What makes this extremely special is this month also marks the 25th anniversary of Prevea Health when it was introduced to the Green Bay community. After we ramp up and are operating fully at full capacity at UW Green Bay, and pending on vaccine delivery from the federal government, we will be administering 10,560 COVID-19 vaccination doses a week. And that will be remarkable. But for us, it doesn't end there. We continue to scale up in the coming weeks at other locations in the communities that we serve with the goal of administering 20,000 vaccines a week to the public. This would not be possible without the partnership we have with our local public health departments and the state of Wisconsin, as well as our Wisconsin University system. We hope that the federal government will continue to provide us with the vaccine supply to help us meet the goal of delivering as many vaccines as we can throughout the entire state of Wisconsin. It's now my honor to turn things over to DHS Deputy Secretary Julie Williams Van Dyke.
Thank you, Dr. Rai, for sharing about Prevea's vaccination efforts and for all the work you and your system have done throughout this pandemic. You've been a fabulous partner. And we also appreciate the incredible work of all of our healthcare partners. We are all in this together, and that is what we need to focus on as we move forward. What a week it's been in the Wisconsin vaccine rollout. As of today, we have administered 213,056 doses of COVID-19 vaccine here in Wisconsin. That includes 30,780 second doses, which means 30,780 of our healthcare workers or nursing home residents in Phase 1A have completed their vaccine series. Most of these second doses have been administered this week. Yesterday, we launched new updates to our vaccine data page to include completed series as well as data on COVID-19 vaccine administered per day, broken down by region and by county. so you can watch the progress that we are making across the state. We started this week by calling on the federal government to allocate more vaccine to our state. I want to be sure when Dr. Rye asks us for vaccine to run those clinics that we have it to give to him, and that is dependent on the federal government. Unfortunately, on Tuesday, we learned the federal government intends to release the second doses of vaccine that they had previously held back. And today we are hearing that may not happen. This announcement and the subsequent follow-up is bringing up lots of questions when it comes to frequency, timing, and long-term planning, and we are still waiting for answers to those questions. This week, we also announced $86 million in funding for local and tribal health departments to support testing, contact tracing, and vaccine administration. Just like our healthcare partners, our public health partners have been and continue to be on the front lines doing life-saving work. And this funding will help make it possible for that work to continue. To support these vital partners in their vaccine administration, as the governor mentioned, the mobile vaccination team pilot program will start next week. This pilot program will start with 9 teams and then will expand, helping ensure access to vaccine in every corner of our state. We will also increase access the following week when partner pharmacies will begin vaccinating residents and staff in Wisconsin's assisted living facilities. That will be possible because we activated Part B of the Pharmacy Partnership for Long-Term Care program this week, and that program requires states to have vaccine banked before day 1 of vaccinations. So our vaccine team has coordinated that launch date to ensure that this requirement was met. All the steps we've taken this week, the announcements I just listed, and all the ongoing work of the vaccine team at DHS and vaccinators across the state are what's strengthening our response, and it makes it possible to get more vaccine to more residents in Wisconsin. And as we expand our efforts, we want to make sure you're well informed, which is why we are starting a weekly email COVID-19 newsletter. You can sign up on our website to receive information on the COVID-19 response and vaccine rollout in Wisconsin directly in your inbox every Friday. You can find the registration link at dhs.wisconsin.gov/COVID-19. I'll conclude today with the numbers describing the pandemic. We are adding 2,269 new cases that were reported today, which brings our total confirmed cases of COVID-19 to 518,251. Our 7-day average of cases is 2,319. Today, we are reporting 32 more Wisconsinites who have lost their life to COVID-19, which brings the total number of deaths to 5,322. Our thoughts continue to be with the families and friends of all of those folks who have lost loved ones. As the governor said, these case numbers and lives lost remind us that we must do everything we can to stop the spread. So I'm going to say it again. Please stay home, spend time with the people you live with, and limit your trips outside of your home to the essentials. Wear a mask, physically distance if you wash your hands frequently, and as we continue our vaccine rollout, we want you to remember these are the best steps you can take to keep yourself and your family safe.